Welcome. My name is Fred Sandoval. I'm the Executive Director for the National Latino Behavioral Health Association. Thank you for joining us today for part three of a five-part series called Platicas, Latino Wellbeing During COVID-19. NALBA is a nonprofit agency dedicated to the well-being of Latino families and communities across the United States. And our mission is to address the disparities affecting the behavioral health of Latinos. Today, we're excited to kick off the third part of this five-part series on how Latinos and their families can and do take care of the emotional, physical, and spiritual well-being during COVID-19. I'd like to thank the Conalma Health Foundation for helping make this series possible. Each month, through November, NALBA will be hosting a professional expert in public health, behavioral health, and the field of medicine to show and share their insights and advice and tips on taking care of themselves, your individual family members, and your community during this COVID pandemic. And then also to talk about what resources are available to help. To get us started, here's how today's Platica will work. I'll start a conversation with our guest presenter about how Latinos can cope and deal with their emotional health and their well-being during COVID-19. I'll have some questions to get us started, but we're actually encouraging the Facebook Live audience who's listening to ask our special guest about things you can do to take care of yourself, your children, your family, and your community. Or if you just want to make some comments, we can share that with our guest speaker as well. So let's get started. I'd like to take a moment to introduce our guest speaker. And I'd like to just say very quickly that Dr. Griselda Villalobos, who's been invited for today's presentation, graduated from the University of Texas at Austin into the year 2009 with a doctoral degree in social work research. And then also she has a second PhD that she received in 2019. So congratulations. She attained a PhD in clinical psychology from the Fielding Graduate University. She has taught social work at the University of Texas El Paso and at New Mexico State University over a 12-year period. Her specialization is cognitive behavioral therapy, which led her to conduct clinical trainings at a Hispanic serving organization called Communal Life in the Bronx in New York, where she trained and consulted with almost 100 community life staff. She's also trained numerous clinicians in El Paso and Ciudad Juarez, Mexico, on the provision of the culturally adapted CBT program. We're just so excited to have her here today. She's going to have a chance to certainly say more and introduce herself. And so, Dr. Villalobos, it's good to have you here with us today. Good afternoon.
Good afternoon. Great working with you again, Fred. I know we've done some work in the past, and it's great that we're connected again through this effort. And so native El Pasoan and everything that, Fred talked about in terms of my clinical background. Most recently, I have been providing mental health services on a full-time basis as a licensed clinical social worker and soon as a licensed psychologist. And so that's my background, and my research interest is in the cultural adaptation of interventions for Hispanics. So I'm happy to be here today.
Oh my gosh, it's good to see you. And you're right, it's been a number of years, but when I was thinking about folks who could bring in their clinical expertise, I thought of you right away and I said, oh my gosh, hopefully she'll be available at some future date. And here you are. So we're going to get started. We have some key questions that we want to ask you, but more importantly, we have a leadoff question. And the leadoff question is going to ask you, what have you learned or seen as the cultural strengths and positive assets of working with your clients, particularly Latino clients?
Yes, definitely a good question. Well, resilience. Some of the research that I've conducted has based itself on the resilience of Latino populations, both in migration and immigration. And so that's one cultural strength, definitely. The ability to withstand a lot and have hope which leads me to the second strength, which is spirituality at
Mm,
different levels. The belief in a higher power gives people hope, and that's another thing that is very evident in the Latino population as we talk about, what has helped you withstand everything you've gone through. And I actually ask clients that sometimes. They tell me everything they've gone through, and then my question is, how have you been able to, handle all of that, childhood abuse, domestic violence, many different things. And a lot of times what they say is my spiritual connection, right? Whether
right.
whatever religion that might be, that's one of the strengths. And then once they identify that, then that's one of the things that we, work with in therapy, to be able to stay connected to that strength. Speaking of connections, the third strength is a family connections. A lot of times when we talk about, the family, being able to do things for their family, I know that there have been a couple of even some campaigns around, do it for the family. So sometimes people won't be willing to do things for themselves, but when they do it for their children, when they do it for their family, they're more willing to take care of themselves for the love of the family. So family connectedness is another strength.
Oh, that's excellent. Yeah, absolutely. Familismo is such critical part of who we are, how we identify, how we interact, and when we do that, it's another portal, right, for how people can take care of themselves or get better or get treatment or get help. And so you've been
Yes.
doing this work for a number of years, and so clearly, the number of families and couples and individuals you work with, you certainly enjoy this work. So tell us about why it is that you love working with families and individuals. What is it that drives you to help those folks that you live and work and play with in that area, right? Because if you think about it, that's your entire community, right?
Right. And as you were, posing the question, I was thinking about, I had little flashes of all of the different, populations that we have an opportunity of serving here in the Southwest.
Mm-hmm.
And that is a military population,
Mm,
the Mexican and Mexican American, to some degree, Central American. We've had the opportunity to work with unaccompanied minors as well. And so, what do I like about this work is, one, being able to see the transformation of someone who comes in burdened with many different stressors and not really knowing, what to do with all of that, and helping them sort things out, understanding what they can control, what they have to learn to accept. And so, just teaching skills. I think part of counseling has a lot to do with teaching. I know that people sometimes don't want to go to counseling. There's sometimes a stigma about it, but in reality, I tell them, just like you said, it's like a platica. We're just going to talk about what's going on with you. I'm going to bring, my expertise, and together we're going to figure out how to help. And so teaching the skills that I then see people apply to their daily life, and how that improves their quality of life. I think that's the biggest thing that makes me do what I do all the time. Yeah.
oh, that's great. Well, that's great. Well, that's a beautiful part of the country, and a lot of folks don't know about the uniqueness of El Paso because of its proximity to New Mexico, and Texas and Mexico. So there's this kind of Paso del Norte region there, and the communities that have lived there for a long time, right? So even before that area was occupied by Europeans, the indigenous communities had lived there for hundreds and hundreds of years. And so, yeah, that area is very unique, and it has quite the history.
Yes.
So yeah, thanks for sharing some of that. I want to ask you a question about something that we're all experiencing today. Stress is a daily experience, right? Um, but what's unique to the circumstances today is that we're starting to see different kinds of stressors, kind of one on top of the other. and they're coming from multiple sources for multiple reasons. So what we're experiencing is the circumstance where our families, our individuals are struggling with, this distress or this overwhelming toxic stress, if you will, that's impacting their well-being. And so my question to you has to do with, what advice you generally would give to individuals who are experiencing the high levels of stress that might even contribute to feelings of anxiety or maybe even feelings of being depressed. So, what advice would you generally be speaking to? Because you clinically have been doing this for a number of years, so clearly clients know that you've been quite the helper and healer for your community. And so, what's the kind of advice you generally would give to individuals?
Well, first, I think it's important to distinguish that stress equals change, right? So when we think about stress, we always think about like negative, but not necessarily. We could be having a lot of good stuff happening, and just adapting to that changing environment can cause stress. So adding to that, the fact that, right now with, the pandemic, there are other things going on, then, so we might have some positive things going on, but then on top of that, some negative. So
Right.
what happens to us is that every time we're confronted with this stress, we go into what is called the fight, flight, or freeze reaction,
Mm.
which our bodies react to that, all the time. So if we're going through that constantly, we're not going to have the same strength to be able to deal with other stressors that might come our way. That's where, the anxiety will develop, some depression, because if we're worried about something over and over and over again, that's going to have an effect on our brains as well. So I think that one of the most liberating things that I talk to people in counseling about is, what can you control? What do you have to accept that you have no control over? And accepting doesn't mean that you're saying it's okay that it's happening, but just accepting that you do not have the power to impact that. It could be very liberating, and it can help people, let go of some of that stress that they're dealing with. Some people also become depressed because they can't control things around them. And the reality is that we can't control everything. So that's the biggest message that I give people who then develop anxiety and depression because of the things that are going on around them.
Well, you've started doing something this year that's very uniquely different from your practice in the years before 2019, and that's your own adaptation to or use of tele mental health services. COVID has really changed how things are affecting communities in every imaginable way. So in the mental health field, professionals like yourself have started to make sure that you can still make your service available to your families, your clients, and your patients. And so it's very telling that you've managed to do that in a very short amount of time. And so that's a unique situation. I mean, I'd love to hear about how you did that and how your patients are reacting to that, and what have we learned so far about the use of telemental health under these circumstances?
Right. It literally happened overnight. Literally, like one day we're at the office, the next day I guess we got the notification of, the city going on lockdown. And
Hmm.
so literally, with the help of staff, we started calling clients and what what do you call it, transforming all of the ability to connect on a particular HIPAA compliant platform, right? So it really happened overnight. And so it required a lot of thinking out of the box, because now you don't have the person in front of you where you can show them manuals, you can write on a piece of paper and show them things. So we've been using all of the technology available, such as emails, and even, being more flexible with telephonic communication, since the governor did mandate that, all of those platforms could be used for communication with clients for some time. And so being able to email worksheets and doing some of the therapies, some of the exercises, deep breathing, everything, through televideo. So in reality, nothing really changed other than being in the same space. But I always tell clients who are a little leery about telehealth that after 2 minutes, you forget. Just like, right now, I forgot that we're actually on video, right? The same happens in counseling. After a while, you forget that you're not in the same room with your provider. We're using the technology to the fullest, sharing screens, reminding clients. And that's another thing that we had to modify was our scheduling and certain policies that we had in our agency, like more flexibility in rescheduling and no-show rates, because we understand that people are at home and, when they're at work, they have calendars that they go by and stuff like that. Right now that they're home, it's really easy to forget an appointment. So we've been, using every kind of reminder possible. So really having a lot of flexibility in that way, thinking out of the box, and just, but being just as effective. I've been treating people since March. I've actually had some people who have graduated from therapy in the middle of a pandemic. So we've been doing something right.
Well, that's great that you've responded to making sure that the therapeutic relationship wasn't significantly affected. It gets changed, obviously, because the people automatically say, well, how does this work? What do I do? But, once you overcome all of that, it's keeping that therapeutic relationship, right? That's so important because, as you said, part of the relationship between a patient and the clinician is that powerful energy that comes from people really trying to explore and delve into the things that really have caused them such distress or duress. And that's such an important clinical relationship, that part of what happens is that telehealth helped you continue to do that. And in fact, someone just shared a comment, and I'll tell you what the comment is. And they said that due to COVID, teletherapy is now reimbursable via Medicaid. And then they put, "This is huge," with the exclamation mark at the end. So say something about that, because it is huge. And it's where what's happened is the system had not been probably as responsive to ensuring telehealth services could get reimbursed. But the question is, how do we ensure that telehealth can continue to get reimbursed? Because many of our clients are Medicaid eligible, right? And then there, of course, are people with insurance as well, private insurance. But the point being is, how can we address that in a meaningful, sustainable way to help you as clinicians get paid for the service that you do, to ensure that our clients can continue to benefit from this model? Because there's data to start to explain how effective it is. But for now, we know the clinical interventions are effective because that's the work that you do. But you want to say something about that, Dr. Villalobos?
Right. And I also want to say that one of the things that at least I noticed, and I'm pretty sure other clinicians have noticed, is that people have been more willing to open up in the privacy and comfort of their own home. So some clients who weren't very verbal, when they would come to the office, now when they're in their own space with their dog, with their cat, with their drink, their coffee, whatever, and just really relaxing, they're more open and more engaged in the process. But definitely going to the question, or, commenting on the services being reimbursed, I mean, that was huge. That was a big step that I would hope would continue, because we've been able to reach people that wouldn't otherwise be able to go to the office for services. Some people don't have transportation. Some people right now are too anxious to leave their home. So if we're able to reach them this way, that's great. And the so the question comes up that, like you said, insurances had not been at least open to reimbursing these services. Now they are. I hope, and I know that some researchers out there are already on the ball researching the effectiveness of certain therapies on through video. And so I think that's what's going to be very important to look at some of that research that shows the effectiveness of it. And I know that CBT through text has already been researched in the past. And it has been found to be very effective, especially with teenagers. There's a program out there that, has been doing some research in that area. So we know it works. We may have to modify it a little bit and take, sometimes we have to wait a little bit as the internet kicks back up again, but everybody has been very flexible, both on the clinical side and the clients, and it's been a really positive experience.
Yeah, this is so great. I particularly appreciate your making reference to the work that you've done with cognitive behavioral therapy, because our initial interactions had to do with some of the work you were doing with Family Services of El Paso, by not only implementing CBT, that's the acronym, right? The initials for cognitive behavioral therapy. But what you all did, and we took note of it as part of a research project our organization did called Community Defined Evidence Based Practices. And you were one of the sites that we studied because you were doing some really incredible stuff. And in the field they call it adaptation, cultural adaptations to an evidence-based practice. Family members would probably wonder, what the heck are they talking about? Well, what we're talking about is how we use treatment methods to help families get better who are experiencing difficulties with anxiety and depression, right? And anxiety and depression is very common with Latinos because there are circumstances that cause that to happen. But needless to say something about your work with the cultural adaptations. I think it's great for the community at large, for Latinos to hear that we're taking into consideration that your cultural experiences are relevant to how you heal, and particularly with these types of more modern day methods, right? Because the modern day methods really are therapeutically researched, and you've done some incredible work with that. So say something about that. I'd love folks to learn more about it because folks would say, mira, esta señora habla en español, pero ¿sabes qué? Mira, me hace pensar de estas cosas. I'm coming to this clinician because she makes me think about things that, help me sort through things, right? Say more about that.
Okay. So a lot of this is what we've been doing in the Southwest anyway. Back in, 2007, 2008, what we did was to put it down on paper. What were therapists, counselors doing to help address the needs of, Latino populations, Mexican and Mexican Americans, Central Americans, and that's what we were looking at. So cultural adaptation, all it means is modifying the therapy or the skills to meet the cultural needs of the client. So if somebody needs to, speak in Spanish, we provide the therapy in Spanish. We hold bilingual sessions. We hold Spanglish sessions, depending on the needs of the client. And one of the things that was done there at Family Service was there was matching of the clinician with the client so that there could be a more positive cultural experience. Now that doesn't mean that you have to be of the same ethnicity or culture as your counselor, but it does mean that maybe there's something that might make the counseling a little more appealing to certain groups, right? The use of Mexican sayings, for example, infusing those into the counseling. And I go back and forth with the word therapy and counseling just so people understand that, it's pretty much, it doesn't have to seem like it's this, big thing that is being done to them. It's a platica. It's learning about what's going on and putting together what's out there to help them in the best way that will meet their needs. With that said, one of the things that we learned is that case management
Hmm.
along with counseling is very, very important, because people who come to counseling sometimes don't just need to learn a therapy, they also need assistance with other day-to-day kinds of things. So in my therapy sessions, sometimes I will do a little bit of case management, because I know that that is something that my clients might need, maybe make a couple of referrals here and there. So we just don't focus on, the therapy itself.
Yeah, that's excellent. Well, that's excellent. You have me thinking about something that you said, and that is early on you mentioned spirituality, right? And and everyone's spirituality looks uniquely different, as not just as individuals, but as families or as communities. And but having said that, when we think about our culture and our language, it, our belief systems help determine how we look for help or seek help or healing, right? And because that's the motivating factor, that's the fuel that gets us to then when do we reach out for help, right? And It reminded me of a proverb in Spanish, and I'll say it in Spanish and English. And it always reminds me of counseling, by the way. And it says, "Algo comenzado no es algo completado," right? So something started is not something finished. And what we find in the clinical field is Latinos will drop out of services very early on, right? So they're having some experience with the professional clinical world that causes them to drop out, right? So they start, but they don't finish. So that's significant, right? So when you talked about how do we use culture and language to help do that? Say more about that, because folks who want help and seek help do that, and we just oftentimes don't talk about all the ways that they do that before they see a clinical professional, right? So say a little more about that.
Yes. One of the things that we did and do, because it helps, is to orient the person to the therapeutic process. What can you expect from this process, right? The same like you did when you introduced this program right now. You said, what can you expect from this program? The same in therapy, so that people don't think that it's you just go once, you feel better, and you don't have to come back. So really explaining to them what needs to happen, that it's not something that happens right away, that it's a process. I think that that's really important for for them to understand, so they don't drop out, right? The other thing is to explore and let them know you're seeing them. And this is for any culture, right? For any client, that you're seeing them, not as bunching them all together, right? It's who are you? I am interested in knowing you. And if a therapist can convey that, I think that, at least we've got the first step completed, that people feel like we're interested in finding out about their culture, their spirituality, their experience. Sometimes what I tell them is, you're an expert in your life, right? I'm an expert on these therapies that I went to school for a bunch of years to learn, but we're going
Right.
to put those together to make some changes that you choose, because I'm not doing this to you. We're doing this together. So establishing that partnership is very important.
Nicely said. And particularly, you also touched on something that was very important, especially with Latino communities and Latino families and us individually, right? Is we place such heavy value on privacy and confidentiality, and that's what therapists really do bring to the table, right? So part of, as we say, earning people's trust is how much they can trust sharing information that then you keep private and confidential. Because I particularly like what you said about when people are talking to you from their home, what's the safest place in their world, right? Is their home.
True.
And my God, it's like telemedicine, mental health is accentuating the value of that, because if that means those individuals can, visit with you and talk about these things that are very personal, right? And so, yeah, thank you for sharing some of that.
Yeah. And
Um,
we do guide them as to privacy because they are in their home. We let them know, make sure you are in a private place. So a room, so that, that's also important because even though they're in their home, that doesn't mean they have complete privacy, right? So that we guide them to knowing what's the best time, what do you feel comfortable talking about. That has also been a little bit of a modification that we've had to make with telehealth and relationship. You've touched on the importance of relationship. Collectivism in the Latino population is so important, and we relate to one another. And I think that also has to come out in the therapeutic and counseling process, that people feel connected with their provider.
yeah, absolutely. Yeah, Latinos are very relational in nature, right? And as you said, know who I am first before you talk about my problems, right? In other words, because it's our experience, our life circumstances, but people really, Latinos greatly appreciate when you can take the time to start from that place of building rapport, trust, and recognizing that, as you said, que una mano lava la otra y las dos lavan la cara, right? Each hand washes each other and they both wash the face, right? It's that dynamic, and how do we help a person feel like we're an additional support to them? So thank you. I want to ask you a question. Someone mentioned here on the screen, they repeated actually uh, something you said about fight, flight, and freeze. And he also commented along that lines to say that human beings can adjust to their environment. And so speak to that adjustment. I think that's a really important point that our colleague says here, because it's absolutely true. Your point about resiliency is about how do we adjust to the circumstances, right? And that adjustment is particularly important with what we're experiencing now. But I want you to speak about to the adjustment of when we have to return post COVID-19.
Okay. Let me address that. The first part is, yes, we are put together to survive, right? So that fight, or freeze reaction is to
Hmm.
protect us, right? And so the issue is not being able to do that, but how often do we have to do that? If we're in an environment that requires that over and over and over again, it's going to deplete or take away some of our energy, everything that we use to, to be able to live day to day. And that's when you begin to see some of the symptoms. um, so yes, we can adapt, but everything's on a line, right, on a spectrum, if you will, right? So a little bit of anxiety is good. Too much anxiety becomes too much. It becomes a disorder once it becomes impairing, right? So that's one thing. And the other one is, how are we going to adapt to post COVID?
Yes,
Right? That was
yes.
the other question. That's a good question. I have actually thought about and heard comments about, you know, are we ever going to be able to get close to a stranger more than 6 feet? After they say it's all clear. I think there's always going to be that little bit of hesitation, and I think that we've become more cautious, and there's really nothing wrong with that, right? To be more cautious. I also think that we need to be careful that, again, we maintain some balance in, however we react after. So I don't know if there's like any specifics that, we could talk about in terms of adapting post-COVID, but I think that in terms of, even driving, I get in my car maybe, well, when we first went into lockdown, I think I got into my car like 3 weeks after, and I didn't remember how to drive. I was like, this is weird. It felt weird. So what are some of those things that we used to do automatically that aren't going to seem so automatic anymore? We're going to have to think about it, right? When we're going to be more strategic about when to go to the store, how to do things. So it will require some adaptation. I guess the key there is just stay balanced. In anything you do, just maintain balance.
Yeah, thank you for sharing those because Latinos we nos gusta dar abrazos, right? We're huggy type people, right? But now we've been keeping our distance from each other, and so you're used to kind of giving grandma that big smack, in the face with those vessels, right? You just want to kiss her in the face and just want to be with your family and your relatives. So some of that has actually altered the way we normally act or behave, right? And so there'll come a time where we have to then readjust to that, and how do we prepare for that, right? So
Yeah,
do
and
you
I
have?
think a lot of people have adjusted well. Like we give air hugs, right? And
Yeah,
we have
right.
this little conversation about I would hug you, but you know. So open communication, I think, is really important. Also.
Excellent. Well, that reminds me of a campaign that's taking place right now. It's called How Right Now, and it's a really cool messaging campaign about how to talk and cope with this COVID situation because of its effect on our well-being, our mental health, right? And what I liked about it is the messaging helps you just find the words to use to be able to have these conversations, right? About what we're all experiencing, because the grandma, mom, dad, the kids, whoever lives with us, whatever our household looks like, whatever that constellation looks like, we're talking about these things, but sometimes we're trying to figure out what words to use or how to say it, how to phrase it. And the How Right Now campaign help develop some of that material, because what do you say when you are worried? Or what do you say if you're feeling isolated? What do you say if you're feeling sad? And so what that campaign has done is help put together some information that has really been helpful for individuals to just look up, right? And you can go to howrightnow.org, and I'll repeat it a little bit later, by the way, so that people can find resources. And one of our listening Facebook audience members did something really cool. They actually posted on the live session some resource information, and I love it because she was kind enough to identify the types of resources that people can turn to now that they can benefit from. And she, of course, is speaking to the issues around getting medical insurance coverage or healthcare coverage from programs such as Medicaid and Medicare and those types of programs. And so she was great enough to do that. So we should put a plug in for her because she's out there listening and she wants to inform her community, right? That when you need to get some help, these public assistance resource programs are there for us to be able to have, because for those folks who are unemployed, folks who have lower incomes, or individuals who lost their jobs because of COVID, they you can still benefit from this public assistance and these programs because your families need the help. And so I'll mention this real quickly if I can, Dr. Villalobos. So she put in here Medicare.gov, healthcare.gov, and insurekidsnow.gov. So that's anyway, that's going live right now on Facebook. And is there anything you want to talk about, accessing resources and what families can do if they decide to look outside of their house or their own personal situation for looking for help? Did you want to say something about reaching out for assistance and support and programs?
Right. And so, in their own local mental health authority, in El Paso, we have Emergence Health Network, which is our mental health authority. They've implemented a lot of different programs, churches, food drives, food banks, which, as you were speaking, and the fact that our listener posted that, it reminded me of everything about resilience and connectedness and how people in time of need band together, and how I have some clients who are dealing with their own anxiety, but on some of their work weekdays, they're out there helping in food drives. And that's helping them with their symptoms, right? Feeling like they're contributing to their community. So those are some of the resources, your local mental health authority, churches. There's some community agencies like, here in El Paso, we have Familias Triunfadoras, who is a, what do they call that? Not for profit organization, which is helping the community. There are a lot of services out there. So I hope people don't feel alone. Reach out to um, the therapists that are out there. There's always community agencies that will provide services such as Family Service of El Paso for on a discounted rate or on a fee-for-service scale. So the services are out there. Look for them. 211 is the number that we call here in Texas to get more information. I don't know in New Mexico if there's like a general number where people can call up for resources, but in Texas that I know is available, and they have a list of different resources available to people.
Yeah, yeah, we do have 211 here in New Mexico too, and most states have it because I believe it's a national network. And 211 is like if you want information. I remember in the old days you would call 411 to get a phone number. Remember?
Mhm.
I don't think I can't remember ever recently using 411 to get a phone number, but you're right. 211 is a resource that people can contact and get information about resources for when you're looking for professional help, because the families have a natural support system already too, right? Oftentimes we actually use those first and foremost before we even ever seek professional help, right? Because the whole idea is that sometimes when you're trying to confide in someone or you're trying to just express yourself, you want to get it out of your head, out of your system, kind of check in with, that trusted older brother, or you check in with that comadre, or you call your madrina, or the point being there's a very strong natural support system we turn to. But let me ask you this question. This is something that's unique to this COVID period, and it has to do with grief and loss and how that has altered things we traditionally do during the time of grief and loss, right? So if you lose a family member during these periods of COVID, whether or not they may be related to a COVID case or not, it's still the same impact. Is that, particularly with those that do have COVID cases, you can't visit the family members at the hospital. And then when it's time to be able to get funeral services in place, all the traditional things that we would do for helping us grieve are not quite the same, right? Por ejemplo, una despedida, right? Despedida is a cultural practice for when we're trying to have that moment with our loved one to express those things that are important to us to say to them before they pass away. So now we can't even do some of those despedidas, and then we can't even see them before they get buried, right? And so there's just a whole lot of things that affected the Latino community. And what advice would you give us now during these challenging times? Because uh, this is having an impact on our well-being. What would you offer to those individuals and families experiencing that?
Well, it definitely has an impact on, our understanding of the grieving process and, finding closure, saying goodbye, which is very important in that situation. But I think this is also a, an area where we can begin to think outside of the box and use some of those resources that, as a Latino community, we've used in the past to help with some of that healing. The altares, if that is part of your rituals, that could be helpful. And finding ways to memorialize the person who has been lost. Um, and also, definitely, it's going to be something that in counseling, it's going to have to be addressed. I couldn't say goodbye, and, finding closure in different ways. So the therapist can be very instrumental in helping somebody go through that grieving process under these different circumstances.
Yeah, thank you for saying that because, as one of our earlier audience members typed, when he said human beings can adjust to their environment. Well, here's a situation where we do have to adjust, right? Because what's happening is that what we traditionally would think of in terms of a period of one's uh, death. I can recall when my dad was in the hospital. Um, they had him in one of the hospice rooms, right? And the family shows up, right? So there's his kids, his wife. Then all of a sudden you have the grandkids, and then the great grandkids. There was probably at least 30 people in the room, right? Um, so that means cuando llega la palomilla, when all the crew comes, all the family members come, we're sharing in all of this process collectively, right? And so that's been taken away from many of us. And so, I appreciate your talking about looking for other ways of expressing that, as our colleague had said. So I'm gonna ask you a couple of other questions, and then we'll keep looking to see if we get questions or comments coming in, and ask you some of that. Um, so when you have individuals who are feeling isolated or worrying about the circumstances with what's happening in our country today, uh, clearly people's well-being, their emotions are starting to be impacted. So we're starting to see an increase in things such as people being more anxious, people being more depressed, people drinking more. And so we have to attend to that somehow. And what should we be thinking of as a community and as a nation about how do we pay attention to people's mental health? And particularly in our conversation about Latino mental health, because it is that important. It is a crisis, and we need to be able to do something about it, right? And from your vantage point, you're a soldier on the ground. You're on the ground doing the work every day with our families, and that's where people are getting better is in your space, your offices, and your work. So, what should we be doing to address that right now?
I think one of the things are programs like the one that we're doing right now, that your organization is putting together, and other organizations nationally, and so putting the word out, lowering the stigma of mental health, and calling it a platica takes away the kind of the scary part of seeking help. And for family members, I think that being open to telling, your brother, your sister, your mother, hey, why don't you go talk to somebody, right? And it's not the same to talk to a family member because, one, they might be also going through the same thing, right? And so they're not really going to have the resources, the emotional resources to help you. But just telling somebody, it's okay to go talk to somebody. So giving people the green light, I think, is very, very important. And I know that locally and nationally, there are many organizations that are already doing that. They have different campaigns to, take away the stigma from seeking help. And so continuing to do that. In terms of the person themselves, I think that one important you know, suggestion is don't bombard yourself with everything that's going on. I know that some people are on the news 24/7. That's too much for the brain, to handle. So, stay away from the news and take care of yourself. Make sure you're sleeping, you're eating, you're having some fun. I know that even though there's a pandemic, walking is still allowed. I tell people, my clients that I work with in therapy, go out to your backyard, walk around your backyard, let the sun hit you, let the breeze hit you. Some of the things that, we don't do anymore because we're inside the house all the time. So taking away the stigma, making it seem, I mean, this is something that we all need to do. Wellness is everybody's business, you know? So just looking at our lives spiritually, emotionally, mentally, physically. And like I tell my clients, not if there's not one thing that's going to take care of it all, but if you do a little bit in each one of these areas of your life, all of it put together is going to make some difference.
That's nicely said. It's creating balance in kind of the different aspects of our life, right? Our physical or emotional or spiritual well-being. You know, something that I've heard a lot these days, which I hadn't really, you wouldn't have heard this before, because now that all of us are in our homes more so, and there's less things on the outside that are taking from our time, effort, and energy, is how much of that time, lever, effort, and energy is being directed to our partners, our families, our relationships. And I have been hearing people more and more say that their spirituality is getting stronger, their relationship with their partners and spouses is getting stronger, that they're talking more, that they're spending more quality time together. And so this has been quite the period of reflection, right? So even though we started with the initial impact and then people made the adjustments, now some deeper reflection, this is a great opportunity, right? And so what a way to benefit from, doing the things that are helpful to our emotional health, right?
Right.
And
I know that I started cooking at home more,
ah,
making the platillos that, I always wanted to make, but never had time to make, and I know people are, sometimes reorganizing their homes and just really doing some of those things that are very productive. And I'm glad you brought that up because, sometimes we can get really hung up on all the negative, but
right,
there's also a lot of positives that can come from this. What was that one slogan? It's not I'm stuck at home, but I'm safe at home.
right.
That that really made a lot of sense to me. If we reframe what staying home means, it doesn't mean you're stuck at home because that could give you a lot of anxiety and negativity, but you're safe at home. Enjoy it. You haven't been
Yeah,
able to do this for a long time because working and school and everything that was going on before.
yeah, that's absolutely right. We had someone say, we were speaking, they said, physical exercise is wonderful. It's a holistic approach. Yeah, that's absolutely true. I mean, we've actually seen people camping more, hiking more, walking more. So people have come up with opportunities to do what? The things that they weren't spending time doing. So I appreciate her comment, and you're absolutely right. Our attitude, the way we perceive how we can do these things, really, it's a great opportunity, really, to be able to take advantage of how we're investing our time back into ourselves, into our families, because in some ways, at the end of the day, we're demonstrating how we value our families, right? Because Latinos have always said, well, if you ask them what's the thing you value the most, I would say that 90% of the time people will say it's my family. Well,
Right.
gosh darn, now imagine you have more time with your family, and if you value your family, which we do, then my God, can you imagine how you build on those assets and that bonding and that opportunity to, guess what, take care of each other even more so, right? Because it's about how do we protect our families, how do we provide for our families, and then how do we promote helping each other during these challenging times. And those are just cultural beliefs of what we do naturally. So we're really in that space where we need to cultivate more and more of that. Well,
Yes.
Dr. Villalobos, my God, you're just been a wealth of knowledge and expertise, and I just so appreciate your spending time with us today. So we're going to give you an opportunity to share with the Facebook audience anything more you'd like to impart and express, because you've been in this business of helping our communities for a very long time, and in this new environment, what would you like to say to the Facebook audience across the nation? Because will get recorded and we'll get to share this in multiple national sites. And so, what would you like to impart before we start to wrap up?
Well, definitely one day at a time. Definitely. I live by that. I talk to my clients about that. You know, don't live so far in the past that you forget about today. Don't live so far in the future and with the anxiety that that could bring, that you forget to enjoy today. So today is the day. This is what we have. This is what we can control. Can't control the past. It already happened. You can't control the future. I mean, you can plan, but you can't be absolutely, you know, you can't control it in an absolute way. But today you can decide, you know, you decided to listen to this broadcast, you know, you decided to, I saw one reader who had lost some weight while he or she has been at home. So they were able to make that choice. So we can make choices today, thinking balanced and holistically, and that's all we can do. And we have to repeat that to ourselves. And in Spanish, no hay mal que dure 1000 años, right? There's no bad that lasts 1,000 years. And we have to remind ourselves of those kinds of sayings.
Yeah, yeah, they're
That's what
powerful.
helps us survive even the most difficult situations.
That's absolutely right, and it's been so great to spend this time with you, Dr. Villalobos. And before we say goodbye to our Facebook Live audience, I better take a peek to see if there's anything else there that I may have missed, you know. But it's been great to have you with us today in this broadcast, and we will be doing these platicas for several more months, actually, and we'll be bringing on folks just like you who present things factually in ways that people can understand and that more importantly, people will appreciate because my experience and what I've learned certainly over my career is Latino communities have always said, we just need more information and we want more education. And so you have provided both today, and I want to say thank you. And more
Thank you.
importantly, is I'm sure we're going to get to continue to do some work in the future for the benefit of our families because they so rightfully deserve it. And for those of us in the helping professions, that's exactly why we're in the profession. So with that, Dr. Villalobos, mil gracias. I want to say thank you to you once again, and stay safe and stay healthy.
Thank you. You too, Fred. Thank you very much.
You're welcome. Adios.